Welcome to Module 6 of your wound care learning journey. In this session, we'll move beyond acute and chronic timelines and dive into wound types by cause and context. Whether it's a planned surgical incision or a traumatic puncture wound, knowing what you're looking at is step one to providing effective care. Let's explore the most common wound types you'll encounter on the floor and how to respond like a clinical pro. By the end of this module, you will be able to classify wounds based on their etiology, depth, and tissue involvement. Recognize clinical features of surgical, traumatic, burn, and other wound types. Apply this knowledge to guide triage, documentation, and interventions. Understand how wound type influences healing and complication risk. This knowledge isn't just academic. It helps you choose the right dressing, escalate care when needed, and advocate for your patients with confidence. Correctly identifying wound type is the foundation of effective wound care. Wound classification impacts what you document, how you intervene, when you refer or escalate, and ultimately, how well your patient heals. In Module 5, we focused on healing timelines, acute versus chronic. Now, we shift gears to focus on wounds by cause, surgical traumatic. Burn, skin tears, bite wounds, radiation. Induced other, less common types. Let's examine each in detail. Surgical wounds are intentional incisions made during operations. These usually heal by primary intention, with the skin edges neatly approximated. Classification: clean, no contamination or inflammation. Clean contaminated, controlled entry into respiratory GI or GU tracts, contaminated. Open wounds, major breaks in technique, or spillage, dirty, Xiang infected. Existing infection or devitalized tissue, healing. Typically acute, with healing in 7 to 14 days. Risk of becoming chronic, if dehiscence, hematoma, or infection occurs. Nursing focus: inspect for infection, redness, warmth, drainage. Manage drains, change dressings per protocol. Perform suture, staple removal as scheduled. Educate patients to avoid strain and monitor for delayed healing. Proactive nursing care keeps these wounds on track for rapid recovery. Traumatic wounds are caused by accidents, falls, or violence. They're unplanned and often messy. Types include abrasions, lacerations, punctures, crush injuries, avulsions, tissue torn away. Healing, often by secondary intention due to irregular edges or contamination. High risk of infection, especially with foreign bodies or delayed treatment. Nursing focus: irrigate and debride as needed. Watch for signs of compartment syndrome in crush injuries. Update tetanus and check immunizations history. Support pain control and psychosocial needs. Each wound tells a story. Your role is to clean, assess, and prevent complications. Burns damage skin via thermal, chemical, electrical, or radiation sources, and they're classified two ways: by depth, superficial, first degree; red, dry, painful; partial thickness, second degree; blistered, moist; full thickness, third degree; waxy, leathery, insensate. Deep full thickness, fourth degree, involves bone or muscle. By extent, use the rule of nines or Lund-Browder chart to estimate total body surface area, TBSA. Burned considerations: burns to hands, face, perineum, or joints can impair function. Inhalation or electrical burns may not be immediately visible. Assess airways and cardiac risk. Nursing focus: airway management is priority. Use moist dressings and topical antimicrobials. Manage pain, fluids, and risk of infection or contracture. Burn care is complex and urgent. Your assessment can be life-saving. Skin tears are common in older adults or steroid-dependent patients. They occur with minimal trauma, like a reposition or tape removal. Classification: ice tap. Type 1, no skin loss, flap is viable. Type 2, partial flap loss, not viable. Type 3, full skin loss. Healing can be acute or chronic depending on depth and care. Nursing focus. Reposition flaps gently if viable. Use soft silicone dressings. Educate caregivers on safe handling. Prevention is key. Handle skin like silk. Bites from humans or animals pose a high infection risk. Deep punctures trap bacteria and anaerobes. Common pathogens: dogs, Pastorella, staph, cats, Pastorella multocida, humans, Streptococcus, Eikenella. Healing: delayed or secondary intention due to microbial contamination. Nursing focus. Irrigate with high-pressure saline. Administer prophylactic antibiotics, e.g., Augmentin. Check rabies and tetanus status. Monitor closely for signs of cellulitis or abscess. Early action prevents severe complications. Radiation-induced wounds can appear weeks to months after cancer treatment. The skin becomes fragile, poorly vascularized, and slow to heal. Characteristics: inflamed, atrophic, or necrotic. Poor perfusion, prone to chronic ulceration. Nursing focus: use non-adhesive dressings to avoid trauma, minimize friction or pressure. Coordinate with oncology for long-term management. These wounds demand patience and a gentle, consistent approach. Some wounds fall outside the usual categories, but still need focused care. Pilonidal sinus wounds, drain or catheter site wounds, medical device pressure injuries, MDR-PIs, donor sites from graft procedures. Each requires tailored assessment, dressing choice, and prevention of further trauma. Let's bring everything together with this summary table of common wound types. Each one differs in how it's caused, how it heals, and what complications we need to watch out for. Surgical wounds result from planned incisions. They usually heal by primary intention, but risks like dehiscence and infection can still arise. Traumatic wounds from accidents or injuries often heal by secondary or delayed intention due to contamination or irregular edges. Burns, whether thermal, electrical, or chemical, may require secondary healing or grafting. Risks include fluid loss, infection, and long-term scarring. Skin tears are common in the elderly due to shear or friction. Healing may be primary or secondary, but these wounds involve fragile tissue and potential skin flap loss. Bite wounds, whether human or animal, almost always heal by secondary intention due to their high infection risk from polymicrobial exposure. Radiation-induced wounds develop as side effects of cancer therapy. These often become chronic, with complications like ulceration and poor perfusion. Understanding these distinctions ensures that we choose the right dressing, escalate care appropriately, and ultimately help wounds move forward, not backward, on their healing journey. Every wound has a story, and how you respond starts with classification. Understanding cause, healing trajectory, and complications allows you to tailor care, reduce delays, and ensure safe outcomes. This module gives you a clinical compass to navigate wound types. Up next, condition-specific care for pressure injuries, diabetic ulcers, and vascular wounds. Thank you for learning with us. Your knowledge saves skin, function, and lives.